If you think your blood pressure is just a simple number shown on a machine, then you might be living under a dangerous illusion. Every day, millions of people make decisions about their health based on a single reading, 120/80, 140/90, and assume that number defines everything. But the truth is far more complex. Your body is not a static system. It's constantly reacting to stress, sleep quality, emotions, hydration, and even the time of day. Yet we reduce all of that into a single measurement and treat it as absolute truth. Imagine someone judging your entire personality based on one word. That would be inaccurate, right? The same logic applies here. Blood pressure is more like a snapshot than a full movie. It captures a single moment, not the full story of what's happening inside your body. And if you rely on that one number without context, you could either panic unnecessarily or ignore a real problem that needs attention. This is where most people get misled. Not because they're careless, but because they've been taught to trust the number blindly. Now consider this. Have you ever noticed how your heart feels different when you're stressed, excited, or even slightly anxious? That's because your blood pressure isn't fixed. It fluctuates constantly. A single reading taken at the wrong moment can make it seem like something is seriously wrong when in reality your body is just responding normally to a temporary situation. For example, walking into a clinic can make some people nervous, causing what's known as white coat reactions, where the blood pressure spikes temporarily. If that reading is taken as final, it could lead to unnecessary fear or even medication. On the other hand, someone who is relaxed during a check might appear perfectly fine, even if their blood pressure tends to spike at other times. This inconsistency shows why context matters so much. Your body is dynamic, not predictable in a straight line. Ignoring that fact is one of the biggest mistakes people make when it comes to understanding their health. Here's where things become even more surprising. Many people believe that if their blood pressure is normal, they are completely safe. But that's not always true. You can have normal readings and still be at risk due to other hidden factors like poor diet, lack of physical activity, chronic stress, or underlying conditions that don't immediately show up in a standard measurement. Blood pressure doesn't always give early warnings in a clear way. It can remain within an acceptable range while damage slowly builds over time. This is why experts often emphasize trends over time rather than isolated readings. One number doesn't define your health, but patterns do. If your readings are gradually increasing over weeks or months, that trend is far more meaningful than a single good or bad result. Unfortunately, most people never track patterns. They only react to individual numbers. Another common misunderstanding is the idea that higher numbers automatically mean immediate danger. While extremely high blood pressure can be serious, not every elevated reading is a crisis. Your body naturally adjusts pressure based on activity. For instance, when you exercise, your blood pressure rises to supply more oxygen to your muscles. That increase is not only normal but necessary. Similarly, emotional stress can temporarily push your numbers higher. The problem arises when people see one elevated reading and instantly assume the worst. This kind of reaction creates a cycle of anxiety, which can actually raise blood pressure even further. In other words, fear itself can distort the numbers you're trying to measure. Understanding the difference between temporary spikes and long-term elevation is critical, yet it's something most people are never properly taught. On the flip side, low blood pressure is often ignored or even seen as a sign of good health, but that's not always accurate either. While slightly lower readings can be normal for some individuals, excessively low blood pressure can lead to dizziness, fainting, and reduced blood flow to vital organs. The key point here is that normal is not the same for everyone. Each person's body has its own baseline, influenced by genetics, lifestyle, and overall health. What's perfectly normal for one individual might be problematic for another. This is why comparing your numbers directly to someone else's can be misleading. Your body operates on its own unique settings, and understanding those settings requires more than just reading a chart or memorizing a standard range. Let's talk about something even more overlooked: timing. When you measure your blood pressure can dramatically affect the result. Early morning readings, for example, can be naturally higher due to hormonal changes that prepare your body to wake up and become active. Evening readings might be lower as your body winds down. If you measure at different times without considering this variation, the numbers can seem inconsistent or confusing. Add factors like caffeine, recent meals, physical activity, or even how you're sitting during the measurement, and the variability increases even more. This doesn't mean the readings are wrong. It means they need context. Without understanding timing and conditions, you're essentially comparing apples to oranges and expecting consistent results. Another critical factor is how the measurement is actually taken. Small mistakes in technique can lead to inaccurate readings. For example, sitting with your legs crossed, having your arm unsupported, or using the wrong cuff size can all distort the result. Even talking during the measurement can raise your blood pressure slightly. These might seem like minor details, but they can significantly impact the numbers you see. This means that sometimes the issue isn't your health, it's the method being used. Yet most people are never trained on how to take an accurate reading. They simply follow basic instructions or rely on automated machines without questioning the process. Over time, this leads to a false sense of certainty about numbers that may not even be accurate. Now think about the role of stress in all of this. Modern life is filled with constant pressure, deadlines, responsibilities, financial concerns, and digital overload. Your body responds to this stress by releasing hormones that temporarily increase blood pressure. If this response happens frequently, it can start to feel like your normal state, but in reality, it's your body being stuck in a prolonged stress response. This is where the real danger lies, not in a single reading, but in the chronic patterns created by your lifestyle. Managing stress isn't just about feeling better mentally. It directly affects your physical health, including your blood pressure. Ignoring this connection is one of the biggest reasons people struggle to control their numbers despite taking other measures. Diet also plays a major role, but not always in the way people think. It's not just about reducing salt intake. It's about the overall balance of nutrients in your diet. Potassium, magnesium, and fiber all contribute to healthy blood pressure levels. Highly processed foods, on the other hand, can disrupt this balance and lead to long-term issues. Hydration is another factor that often gets overlooked. Even mild dehydration can affect your blood pressure readings. These details highlight an important truth. Your numbers are influenced by your daily habits, not just isolated medical conditions. Changing those habits can have a significant impact, but only if you understand how they connect to the bigger picture. Finally, there's the psychological aspect, the way you perceive your own health. If you constantly check your blood pressure and worry about every fluctuation, you may unintentionally create more stress, which then affects your readings. This creates a feedback loop where anxiety drives the numbers, and the numbers increase anxiety. Breaking this cycle requires a shift in mindset. Instead of seeing blood pressure as a strict judgment, it should be viewed as a tool, something that provides information, not a final verdict. When used correctly, it can help you understand your body better. But when misunderstood, it can lead to confusion, fear, and unnecessary decisions. And that's the real truth most people never hear. As you begin to understand how misleading a single blood pressure reading can be, it becomes clear that consistency matters far more than isolated numbers. Think of it like tracking your weight. You wouldn't step on a scale once and assume that number defines your entire fitness journey. The same principle applies here. What truly matters is the pattern over time. Are your readings gradually increasing? Are they stable throughout the day? Do they spike only during stressful situations? These are the kinds of questions that provide real insight. Without tracking trends, you're essentially guessing. And in health, guessing can be risky. This is why many experts recommend keeping a simple log of your readings over days or weeks. When you step back and look at the bigger picture, you start to see patterns that a single measurement could never reveal. But here's something even more surprising. Your breathing alone can influence your blood pressure in real time. Slow, deep breathing can help lower it, while rapid, shallow breathing can increase it. This means that even the way you breathe during a measurement can affect the result. If you're anxious and breathing quickly, your reading may come out higher than it actually is. On the other hand, if you take a few moments to relax and breathe deeply before measuring, the number may drop. This isn't manipulation, it's simply your body responding naturally. Understanding this gives you a level of control that most people never realize they have. It also highlights just how sensitive blood pressure is to even the smallest internal changes. Sleep is another factor that silently shapes your blood pressure, often without you even noticing. Poor sleep quality or lack of sleep can lead to consistently higher readings over time. When your body doesn't get enough rest, it stays in a semi-stressed state, releasing hormones that keep your blood pressure elevated. This is why people who regularly sleep less than 6 hours a night are more likely to develop long-term blood pressure issues. Yet many overlook sleep completely when thinking about their health. They focus on diet or exercise, but ignore the one thing that allows the body to recover and reset. Improving sleep isn't just about feeling rested, it's a direct investment in your cardiovascular health. Physical activity also plays a dual role. During exercise, your blood pressure naturally rises, which is a healthy and necessary response. But over time, regular exercise actually helps lower your resting blood pressure. This can be confusing for many people. They see a higher number during activity and assume something is wrong, when in fact it's a sign that their body is working efficiently. The key is to distinguish between temporary increases and long-term benefits. Consistent physical activity strengthens the heart, improves circulation, and makes your body more efficient at regulating pressure. It's one of the most powerful tools you have, yet it's often misunderstood because people focus only on immediate readings instead of long-term outcomes. Now let's address another common mistake: comparing home readings with clinic readings without considering the environment. At home, you're usually more relaxed, sitting comfortably in a familiar setting. In a clinic, there may be anxiety, time pressure, or even discomfort. These differences can lead to noticeably different readings. If you don't account for this, you might think something is wrong when it's actually just a change in environment. This is why doctors often recommend taking multiple readings at home and bringing that data to appointments. It provides a more accurate representation of your typical blood pressure, rather than relying on a single moment in a potentially stressful setting. Another hidden factor is caffeine. Many people consume tea, coffee, or energy drinks without realizing their immediate impact on blood pressure. Caffeine can cause a temporary spike, especially in individuals who are sensitive to it. If you measure your blood pressure shortly after consuming caffeine, the reading may not reflect your normal state. This doesn't mean you need to eliminate caffeine completely, but it does mean you should be aware of its timing. Ideally, you should avoid caffeine for at least 30 minutes before taking a measurement. Small adjustments like this can make a big difference in how accurate your readings are. Let's not forget hydration. Your blood volume plays a direct role in determining your blood pressure. When you're dehydrated, your blood volume decreases, which can sometimes lead to lower readings or cause your body to compensate in ways that affect pressure. On the other hand, proper hydration supports stable circulation. Yet, many people go through their day without drinking enough water, and then wonder why their readings fluctuate. This is one of the simplest factors to control, but also one of the most commonly ignored. Staying properly hydrated isn't just good advice. It's essential for maintaining accurate and stable blood pressure levels. Medications also add another layer of complexity. Some medications are specifically designed to lower blood pressure, but others, like certain painkillers, decongestants, or even supplements, can raise it. If you're taking any kind of medication, it's important to understand how it might influence your readings. Otherwise, you could misinterpret the results and make incorrect assumptions about your health. This is why medical guidance is important when making decisions based on blood pressure data. Self-diagnosing or adjusting medication without proper knowledge can do more harm than good. There's also the issue of posture and body position during measurement. Sitting upright with your back supported, feet flat on the ground, and arm at heart level is considered the correct position. Deviating from this can lead to inaccurate readings. For example, if your arm is hanging down, gravity can increase the reading slightly. If you're slouching, it can compress your body in ways that affect circulation. These details might seem minor, but when it comes to precision, they matter. Accurate measurement isn't just about the device, it's about the entire setup and process. Finally, it's important to understand that blood pressure is not an isolated metric, it's part of a much larger system. Your heart rate, blood vessel health, hormonal balance, and even mental state all interact to influence it. Focusing on blood pressure alone, without considering these interconnected factors, can lead to an incomplete understanding of your health. The real goal isn't just to control a number, but to support your overall well-being. When you shift your focus from numbers to habits, like better sleep, balanced nutrition, regular movement, and stress management, you begin to address the root causes rather than just the symptoms. And that's where real lasting change happens. And here's the most important takeaway. Your blood pressure is not your enemy, and it's not something to fear. It's a signal, a piece of information that your body provides to help you understand what's going on internally. When you interpret it correctly, it becomes a powerful tool. But when you misunderstand it, it can lead to unnecessary worry and poor decisions. The truth is, your blood pressure isn't lying to you, but the way it's often presented and understood can be misleading. Once you realize this, you stop reacting emotionally to every number and start thinking logically about what your body is trying to tell you. And that shift in perspective can make all the difference.